Welcome all. I'm Yvette Watts, Executive Director of NYAMP, the New York Association of Emerging and Multicultural Providers. Thank you all for joining us this evening to discuss legislative priorities for the New York Disabilities Advocates this up and coming budget year. We are grateful for your support of the services we provide for people with IDD and their families, and depend on the partnership over the years to ensure that our people can live the kind of lives that others take for granted.
Hi, everybody. I'm Winifred Schiff, CEO of the Interagency Council of Developmental Disabilities Agencies. And tonight we'll first review our priorities and then ask a few questions, your answers to which will help our advocacy to be more effective. Thank you for your insights and your help to ensure that New York State continues to be the example for the rest of the nation to follow regarding disability services and supports for people with IDD. So let's do some introductions. I'm going to go around my screen in the order that you appear. So we'll start with Lisa.
Hi, Winnie. Thank you. Welcome, everyone. I'm Lisa Valia, CEO of CUSAC. We serve children and adults with autism throughout New York City and Long Island. And I'm also chair of the Queens Council on Developmental Disabilities.
Marco.
Hi, everyone. I'm Marco Damiani. I'm the CEO of HRC New York City and also the president of the Executive Director Association of New York. We support people with IDD across the 5 boroughs of New York City. And we are the largest nonprofit provider in New York State doing this kind of work. Great to have you all here tonight.
Chris.
Hi, Chris Marchioni, founder and executive director of Person-Centered Care Services, supporting people with intellectual and developmental disability across New York City, Long Island, Putnam, and Dutchess County. Glad to be here tonight.
Matt.
Good evening, everyone. I'm Matt Sturriali. I'm the CEO for Birch Family Services, an organization based in New York City that provides early childhood, school age, and community-based services for people with autism and other developmental disabilities. Also serve as the president of the board of the IAC.
Joe.
Good evening. Thanks for being here. I'm Joe Pancari, President and CEO of CP Unlimited, formerly CP State. We have thousands of folks across the city and Hudson Valley with IDD that we support, as well as now recently folks in homeless shelters, folks in behavioral health issues, social care networks, and a whole host of other community supports as well. So thank you.
Our other Yvette.
Good evening. I am Yvette Brissett Andre. I am the executive director for Unique People Services. Unique People Services is a housing agency. We provide housing for individuals with developmental disabilities, individuals that are living with HIV and AIDS, and behavioral health. We do tax credits, low-income housing. We have a food pantry. We service over 15,000 special need New Yorkers in a year.
Wow. Evan.
Hi, Evan Sullivan with Ostroff Associates, and we represent NYDA.
Evelyn.
Hi, I am the Chief Program Officer for Hardship Human Services of New York, a multi-service agency. We serve people with developmental disabilities, which is our primary or main piece of services portfolio. We also do foster care and adoption. The agency has been in existence for about 150 years. I am also the chair for the New York Alliance for Inclusion and Innovation.
Assemblymember Simon, and it looks like you broke your arm.
Well, no, I had, thank you. I had my shoulder replaced.
Oh,
wow.
But it's much better, although I'm still working on strength.
Okay. Well, good for you. Thank you for joining
Thank you.
us.
My pleasure. Thank you. I'm happy to be here.
Michi.
Hi, everyone. Can you hear me?
Yes.
Yes, hi everyone. My name is Michi. I'm the office administrator for the Assemblyman Stephen Raga. I will have my camera off just because my 4 months baby is on my chest right now. But I'm happy to be here, listen to everybody, and hear your priorities. Thank you, guys.
Thank you so much for joining us. Usman.
Hello, my name is Usman Diallo. I'm from Assemblyman Altiero's office. I'm his legislative director, and it's a pleasure to be with you all this evening.
Thank you. Etofia? I hope I'm not mispronouncing your name. So, Etofia, I don't know. I think there's something with your audio. I don't know if we can help you work on that, but we look forward to your input, so I sure hope we can figure that out. Want to try it again?
Yes. Are you able to hear me now?
Yes.
Much better. Thank you.
Sorry, I'm coming from the post office and my headset is acting a little kooky. My name is Ethiopia Lane. I am the new director of constituent services and organizing for Senator Jabari Brisport, District 25 in Brooklyn.
Great. Welcome. That's a relief. Steph.
Hi, this is Steph McGraw, Chief of Staff and Legislative Director for Assemblymember Claire Valdez in Queens. Happy to be here.
Great, thank you. Let's see, Gillen.
Hi, I'm Galan. I am a spectator for State Senator Andrew Granada, so I'll be here just listening in and, taking notes for him.
Great, thank you. And I'm sorry I mispronounced your name.
No, of course. It happens all the time. Don't worry.
And there was another person who I don't see now. Okay, so maybe they'll join us later. Okay, so we have a slide presentation. And we'll just jump right into that, and we're going to kick it off with Chris.
Yes, hi again. So just to give an overview of what the current service delivery system for people with intellectual and developmental disabilities looks like here in New York State. Hundreds of thousands of people with intellectual and developmental disabilities receive services either through the Office for People with Developmental Disabilities, we call them state-run programs, or over 500 nonprofit disability service providers throughout New York State. Most people with intellectual and developmental disability, about 85%, receive services through nonprofit providers. Agencies will provide services like housing, residential services, 24/7, known as group homes, employment supports, adult day programs where people focus on career or vocational development, voluntary training of involuntary capacity, supporting people who still live at home, children and adults who still live at home with their families, or people who are living on their own. We provide family support services, clinical services, and even respite care for caregivers. Also, nonprofit providers employ approximately, probably over 100,000 direct support professionals. These are the people who directly support people with intellectual developmental disabilities every day, sometimes 24/7. They are essential to this workforce, and they are the ones who keep this system operating.
Thanks, Chris. Next slide with Matt.
Can you hear me now? Okay, there we go. Having trouble unclicking. So just a little bit of background real briefly about how our services and the are generally funded. The supports and services that are delivered for people with intellectual and developmental disabilities are predominantly delivered through the Medicaid fee-for-service program, and most funds are pretty much through the state and federal Medicaid dollars. OPWDD, which is where most of our services are funded through, are not part of the global cap. Our services are funded outside of the global cap, for those to understand. Many providers in many of the services historically have rates that are established based on a cost-based system which is supposed to reflect the actual cost of services. However, several years ago, there was an application of a budget neutrality factor, which began to suppress the increase of keeping up with the costs. It's important to note that back in 2006-07, there was legislation which established an annual cost of living adjustment, now known as the Targeted Inflationary Increase. The intent behind that was to improve the recruitment and retention of workers employed by voluntary providers, so we could keep up with the inflationary costs in terms of giving staff increases, but also supporting the operating expenses of our not-for-profits. However, these are some of the intentions behind it. And while we did see 3 consecutive years of cost of living adjustments, beginning in 2009-10 fiscal year, we went through a 12-year period where there were no COLAs, or what's now known as the Targeted Inflationary Increase. And what this grid here is showing you, that the lack of investment in the OPWDD service system, which is supporting people with disabilities and the frontline workforce who work with them, is that the cost of living, cost of expenses went up by over 56%, and the amount of money that was received by providers in the last few years has been great, with the legislature and the governor investing in targeted inflationary increases. But there's a lot of catching up to do, and that's why we certainly want to be vigilant on ensuring that people understand who we support, the workforce that works with them, and how we might be able to continue investing in this work.
I see someone has raised their hand, and are we asking people to put questions in the chat or comments in the chat?
Yeah.
Okay. So Yulia, if you would put your question or comment in the chat, please. Thank you. Thank you, Matt. Next slide with Marco.
Can we go back to the previous slide just for 1 second? I hope you see there's a flat line there. Matt referenced it. We're lucky that the whole system didn't flatline. And when you look at that, it's striking, absolutely striking, that this sector supporting people with IDD now for the better part of 50 years made it through it all. And I want to go to the next slide now, so I want that context that Matt gave to be really resonant as I talk for a few minutes. There are consequences. No, back one more. Sorry, back one more. Yeah. There are consequences to that flat line. And here, in the most consequential way, it's the workforce. You see a dramatically increasing vacancy rate. Now, part of that's due to the pandemic, no doubt. But it hasn't come down. It hasn't hit the steady state that we need to be providing the types of services that people with ID and their families deserve, number one. Number two, that the workforce is appropriately rewarded and supported for the work that they do. It's been said earlier tonight that there has been really good progress, and there needs to be continued progress. But wage stagnation for that period of time has enormous impact. It's destabilizing not just the workforce. The workforce is why we exist. But when you destabilize the workforce, you destabilize the entire system of care and support for people with IDD and their families. And we are getting a little more stable. We know the federal government has some uncertainties for us coming forward. But I think the take-home message here is when government doesn't step up as they should, as they're required to, and support this population, the system itself develops very significant cracks. The workforce is the canary in the coal mine for the cracks. And when the workforce can't support the day-to-day work, we see consequences such as difficulty in running residential systems, which is the core foundation legacy system in the overall OPWDD funded provider network. And then we see other disruptions. So leading into the next slide, we'll get into that in more detail.
And the next slide is Lisa.
Thank you. I'm going to be talking about the impact on the workforce. And, as Chris and Matt and Marco clearly explained, the DSPs are the backbone of our service delivery system. I just want to highlight the group homes 24/7, but even day programs and in-home services to help families keep their child home longer. And because of the impact of COVID and the prior years of workforce challenges, in 2023, NYDA, along with the Miami University of Ohio, conducted a first of its kind workforce study on DSPs across New York. It was with a survey, and nearly 4,500 DSPs responded to it. And the purpose of the study was to see how the DSP's paid work intersects with their work life, which ultimately impacts the quality of their lives. And if we can provide a work environment where it enhances the quality of their lives, it will improve retention and recruitment. And some of the key findings from that study, half of DSPs reported food and housing insecurity. So despite being full-time, even working additional hours, they still had struggles managing to make ends meet for their families. They told some really compelling stories. One mom said she makes sure that her entire family has dinner before she actually sits down to eat, as just one example. What was really interesting, there was a gap in satisfaction versus the work versus the pay. 85% of the people love the work that they do, and they want to stay in this workforce, but they're completely dissatisfied with the pay because they can't really survive and fend for their families with the pay provided in this field. And many of them hold college degrees, high school diplomas, have college courses, and hold college degrees, 44%, yet they make under $20 an hour. And even though there have been increases in the recent years with some of these investments, still many are under the $20 threshold. It's just not enough, especially in New York City, to be able to survive and thrive. And then, of course, majority of our DSPs are women and individuals of color. So that further compounds inequities in society, and really making it challenging for folks to stay in this field and want to work with people with intellectual and developmental disabilities.
And before we move on from this slide, we have a couple of other comments, I think.
Yeah, I would just like to say quickly, Lisa did a great job covering it. I want to emphasize something. If we were a business and 85% of our employees really loving working for the business, we would invest in them. We would keep them in the business because the business is thriving because they want to be there. We can't raise our prices. So the way that this works is that government recognizes the value of the work to citizens of New York State who have disabilities and their families, and they help us invest in the workforce, in the employees, and in the provider agencies that are supporting those individuals. So the most impactful investment is one that enables the providers to invest in their workforce, but also invest in the important infrastructure that supports the people that support the people. And this study clearly shows that. Thank you.
Thank you. Evelyn.
So 12 years of nothing has gotten us into kind of a pickle in terms of losing ground related to being able to provide our staff livable wages. But the investments that have been made since have created a good positive traction here that is worth noting. We have 15.8% altogether in the last 3 years of COLA and targeted increases that have actually benefited the system very much. We have vacancies down 43%. Turnover has also gone down slightly. And DSP starting wages have improved, not to where we needed to be. We used to be probably maybe $5 away from minimum wage, and I just want to remind everybody that come January we'll come to in New York City to $17 an hour, and that is very challenging for most providers to be able to be way above that, to be able to attract people to do more significant work other than or compared to the food industry, for example. We have starting wages again doing better, but we need to continue to do investments to be able to retain that workforce that is so important for our programs. So I encourage all of us to continue to fight to get our staff a livable wage. So they could actually be not only serving our people, having meaningful relationships with the people that we support, but also support their own families.
Thanks, Evelyn. And before we leave this slide, I just want to emphasize one point that Evelyn just made, and that is that since 2021, we've gotten a 15.8% increase over those years. And that allowed us to increase starting wages by 28.6%, not 15.8. So we are using those funds to, to fund the most important part of our business, which is the DSPs, who are the backbone of our system. And of course, all of our other costs are also going up. So we need to have the flexibility, and the increases, which is why the targeted inflationary increase is so important to us. But the money's going to the right place. Marco and Evelyn.
Yeah, so I mentioned earlier that we are facing a number of uncertainties in the current administration in Washington. We don't need to review them in a lot of detail. But I think that the take-home message here is that many of us have heard and met with our congressional delegation in person or through Zoom or on the phone, and we've been reassured. We've been reassured that people with IDD across the country will not be affected by any changes in the Medicaid program. And it's encouraging to hear that. However, I don't think anybody on this particular meeting right now believes that. And the reason is because there are a number of other levers, many of them are bureaucratic red tape levers, that can affect eligibility, whether it's a work requirement or more frequent eligibility determinations. And certainly things like the SNAP program, which we saw in a terrifying way, affecting potentially millions of New Yorkers and others around the nation, affects the work that we do on a daily basis. So that's sort of a lead in. I'll let Evelyn jump in for some more.
I just want to emphasize that sometimes, even though we are said to be not affected by the changes in Medicaid, it turns out that capacity for government agencies that manage eligibility and research, it's a concern to all of us because we tend to be lumped together, even though there are very specific language and regulations and laws to get us out of that mix. Because bureaucracy actually creates a kind of a vortex where everybody is affected. We may be affected by, certifications that take too long, and providers not getting paid for the services that have been provided, and not an ability for us to be able to recoup that income to be able to sustain the services long term. So that is a very high concern for all of us in this panel.
There are also likely downstream impact on the essential plan. We do have staff that are on Medicaid through the essential plan, and certainly we have family members, many of whom are on that plan, and that could have a very negative effect on family systems that support the people that we support on the family side. So there are a number of consequences here when we look at the federal and state fiscal uncertainties coming up.
And families of people that are receiving services, not maybe residential, but recently during the issue related to the SNAP program, we opened a pantry, and most of the people that used it were people of individuals that attend our day programs, but their families themselves that didn't have enough food to be able to cover their needs. So that is a very important key aspect of our population that needs to be considered.
And our low-paid staff rely on SNAP sometimes.
Yes.
Absolutely.
And the pantry also.
That's right. Evan.
Yeah, so we wanted to just highlight our legislative and budget priorities, which we've been having a number of conversations with the governor's office, OPWDD, Division of Budget. So the first one is asking for a 2.7% target inflationary increase, which is tied to the July Consumer Price Index, which is historically what the measure has been going forward. I think you can see from the numbers that the investments are working. It's helping decrease staff vacancies. Turnovers are starting to come down, and wages are definitely going up. So, as providers are incurring more for costs, this is a critical component so that we don't fall back into what we experienced for over a decade, which was a direct cause of the workforce crisis. What we're also looking at is a larger kind of CareForce kind of agenda. So kind of going back to seeing what we were able to learn from the Miami University Ohio study and is things like housing insecurity. So what we're asking for is a CareForce affordable housing lottery preference. So what this would do is not just for DSPs, but for what we're defining as the CareForce, which would include DSPs, CNAs, LPNs, RNs, behavioral health and human services staff, early intervention and special education staff. They would have an ability to have a preference in any affordable housing lotteries if they're eligible for that type of housing placement because of their income levels, their family sizes. This is something that can be done without any cost to the state, but it also just ensures that folks are having access to safe, affordable housing nearby where they're providing these services. We're also asking for a employer-assisted housing matching grant program. So this would be similar to what for-profit businesses have the ability to provide other types of employee benefits that they can write off their taxes. As not-for-profits, agencies don't have that ability. But this would, by creating a state matching program, it would give provider agencies the ability to provide dollars to employees for things like down payment assistance, emergency rent arrears, other types of security deposits or rent to really help try to stabilize the workforce in the areas that we know is needed. We're also similarly looking at creating a new CareForce mortgage incentive through SONIMA, which would allow for some down payment assistance or for interest rate reductions, for that CareForce that I had just previously described. So really kind of looking at ways to kind of, build into the governor's priorities of, making homeownership affordable and, accessible to folks, especially those that are providing really critical services across our state. And then one other thing that we're looking at is potentially expanding the New York State Child Tax Credit by creating another $1,000 refundable supplement for those CareForce workers. One of the things that we often run into, especially with DSPs or other human services workers that are providing services to people in 24-hour home care, in 24-hour settings or in non-traditional hours, is a lot of the subsidized childcare slots are not accessible to them. So this would be able to provide those type of an incentive through a refundable tax credit to be able to kind of have that type of subsidy to try to help offset some of those costs. So really trying to kind of get a little bit creative in terms of how we're kind of approaching some of these challenges and not just looking at direct dollars into the field, but looking at ways to recruit, retain, and really recognize this critical workforce. The other things we're working on, and these are more administrative that we've been working on with OPWDD, as some of the folks had mentioned, we have a lot of concern about, the changes to the essential plan and the impacts on potentially for employees. This could result in, and we're trying to pull data together on this currently, but there could be a large influx of individuals trying to move into employer-sponsored insurance, which could be a very expensive cost. OPWDD had a program a number of years ago called the Healthcare Enhancement that would provide an offset for some of those costs. So we're looking to try to restart that. And then we're also looking at, aligning with some of the state's climate emission reduction goals, as well as some other innovative service models to ensure that dollars that are being available for capital projects for provider agencies can be leveraged to do things like, if you're replacing a roof on a house or a group home, that makes a lot of sense as a perfect time to do solar panels. Right now, if a provider agency were to submit a project to replace a roof and add solar panels, they would get laughed totally out of the room, even though that is the state's policy to lower, to reduce emissions, right? We have several thousand locations across the state. There's over 7,000 locations. So this is a very capital-heavy industry, and there's a lot of places and a lot of areas where we could be helping the state lower emissions. But right now, the way that the funding is set up doesn't allow for agencies to kind of go after some of those innovative projects. And then we're also looking at increasing the residential reserve for replacement funding, which right now hasn't been changed since it was started. Looking to increase that because those are the dollars for upkeep and for projects at group homes and other locations that are really critical. With the way that it's currently set up, agencies it's very hard for agencies to do things like minor maintenance or bathroom replacements or, fixing cabinets or painting and things like that. So looking to try to adjust that since it hasn't been updated in over 10 years. So those are really the priorities that we're working on for the upcoming year. And we just wanted to share those with you all.
Thanks, Evan. Okay, so we've got a few questions for you, legislators and legislative staff, and we'll kick the first one off with Matt.
Thank you, Winnie. you've just heard a lot of information, and so we figured we'd formulate some questions to stimulate the discussion. And the first one is, we have a new legislative session coming up in January. It's also going to be an election year on the state level between the Assembly and the Senate, as well as a gubernatorial election, as well as the midterms in terms of what's going on in Washington. What major policy issues do you anticipate will lead the discussions in the budget process? And where do you see opportunities for progress in supporting New Yorkers with intellectual and developmental disabilities?
Anyone?
It's always hard to know at this juncture. I think among the things that will be the most discussed will be how do we deal with the cuts coming down from Washington? And as you already talked about, there are things that could come down that aren't like, a cut to people with IDD, except that, they have to eat. One of the issues with regard, and I think it's a great idea, for example, to as you're making repairs, make them carbon neutral. I think the idea of allowing solar, for example, on the roofs, it's actually very inexpensive to do solar, and it saves a lot of money. And it should be the kind of thing that the state wants to do. So it's not only good for the environment and the health of the people that are being housed, but also will ultimately save a lot of money because it's much cheaper to get your electricity through solar than it is otherwise. And so that should be a benefit for the state. I think among the things that are going to be a challenge is we don't have money. There is an anticipated shortfall. We often find that it is that the shortfall anticipated by the executive and the state controller are more conservative estimates than the assembly. But we often find that there are additional tax receipts that come in before April, right? And so part of this is a rolling kind of thing because you never really know what kind of receipts you're going to have. And the estimates made now are based on what they've gotten, but who pays their taxes early, right? So a lot of people, you expect that you're going to get more tax receipts closer to April 1st, right? Because it's the last quarter of that state fiscal year. But that still is going to be a real challenge. So I think the big issue is going to be without cutting, what can we do to stay the same, reduce certain outlays, delay implementation of certain things. As you may, if you've been reading the news, the governor has delayed a number of environmental measures, for example. And part of that is because energy costs are going up because of data centers and crypto, which have been using fossil fuels, by the way. And so one of the challenges is you have a sort of rapacious industries that are using the energy and making that a more complicated analysis and implementation strategy to meet our goals. But of course, our emergencies are fueled by the fossil fuel industry and climate change, right? And so I think that one of the things that the legislative houses will be trying to do is to craft a more coherent approach to that. I think the governor's been responding to the crisis and not necessarily creating a through line that we've been able to detect. Now she may have that, and we don't know what's going to end up being in the state of the state of the state, right? But I certainly think that a strategy that you might pursue is to include some of those measures in the state of the state, right? So that if she is able to include them, that makes it more likely that you're going to get funded, right?
Thanks, Joanne. I see Assemblymember Hooks has joined us. Welcome.
Lynn?
And also, Lester Chang, would you like to introduce yourself real quick? And we will definitely email you a copy of everything.
Great.
Hi, everyone. I'm happy to be back on this meeting again this year. Joanne, fantastic job on answering that question. Very, very thorough.
It was very thorough, and thank you. And it was very thorough. And also, it sounds like, for example, the example that Evan gave in terms of the revised property and that aligning with some of these green initiatives, and clean energy is certainly something. Are there any other strategies from what you know and what you're forecasting that you can suggest will help us align our strategies with other priorities that are on the table or anticipated to be on the table, I guess I should say?
See, I think the issue is reading tea leaves at this juncture. We don't have much in the way of signaling from the governor as to what she's going to put in the budget. And so I think that this is the time frame for us to try and get her to do what we want, right? What are those priorities that we have that she can address that will ultimately end up saving the state money, that will make her less politically vulnerable? Right. I think that there's an issue with a couple of things that policies that have made her certainly people will use those things in challenging her in an election year. Obviously the change to PPL for the CDPAP, right? Thing is an area where it was destined to take longer than the period of time to make a transfer, assuming that transfer was a good idea in the first place, and that the entity was a good entity to transfer to. But all things being perfect, 4 months wasn't enough time to transfer that workforce, right? So that, of course, has played out differently. And that's an area that I anticipate people will be challenging her. I think that the other issue that I think is going to be a big one, last year we had a number of mental health measures. Tomorrow we're doing a hearing on behavioral health workforce because a part of the issue, of course, is burnout, low pay, increasing need for the behavioral workforce. And housing being a big issue, housing first policy, and more, because we know that works. And so some of these issues are issues that I think will be coming up. I don't think we're going to have something that is quite as challenging as last year. But now that we've taken on that particular issue, the next issue is, and what do we do with people who are coming out of a hospitalization? And that gives us the opportunity to talk about some of these other things. And some of those things, while they're not directly related to your population, can have a salutary impact.
Thank you. Okay, our next
If that
question.
made sense, I hope that made sense to you.
Perfect sense. Thank
Okay.
you. I wrote down what you said. Like I
just want you to know I used a big word like salutary. Okay.
I didn't write that down. I didn't. The next question with
Sorry,
Joe.
and I would just note too,
Oh,
as
I'm
a
sorry,
number, NYDA did submit testimony for the hearing tomorrow, and
Great.
we do very closely with our colleagues across the behavioral health side as well. So it's a good partnership we have with them.
Good.
Thank
Yeah,
you.
I thought that you guys were going to be presenting, so that's good.
Yeah.
Because
we
our
didn't
TII request is for them too. Go ahead,
we
Evan.
didn't want to take up a slot because we know it's the focus on the behavioral health workforce, but we did want to submit testimony and some data points.
Great.
For consideration.
Thank you.
Thank you.
Thanks,
Joe,
Elaine.
with the second question.
Yes, thank you. And just before I ask the question, I would like to just mention that although generally we serve people with IDD, we do more and more there are folks who are overlapping with
Yeah,
IDD and OMH issues. that we've
Yeah.
been grappling with. And I think we have made some inroads, and we've been partnering with OMH as well to, provide some interesting ways of supporting people, helping them get out of the hospitals and have more secure and permanent housing options. So I think we're certainly supporting our colleagues, but we're in that boat as well to some extent. And you heard earlier from Evelyn and Mark about some of our worries, with the federal cuts and how it may impact New York State budget. And I know you did mention some of the tax revenue. We're hearing that the tax revenue is a little bit better than what we anticipated. As a matter of fact, recently, State Budget Director Blake Washington recently said that we're in a good spot financially and on good fiscal footing. So since federal Medicaid cuts didn't directly impact IDD services, what steps can we take to ensure that New York doesn't look to IDD sector to fill some of those, gaps in the Medicaid budget?
I would say, advocating for that. I'm glad that Blake said that. We do have some reserves, but for example, one of the issues that is universal childcare. And the tab on that is about the entire amount of our reserves. So we have reserves because we've been careful. And so we're not in an awful shape, but we also just can't use up all those reserves, right? And so that ends up, being more parsimonious with the use of reserves, because who knows what is going to be visited on us going forward, right? Our farmers are starting to hurt because of the tariffs. The cost of chocolate, I just heard today, has gone up 200% because of climate change. And so the tariffs are an issue, but also climate change is an issue in affecting the cost of certain products. So there are, affordability is the big issue. And the question is, how do we deal with affordability? How do we make things more affordable when, in fact, things are increasing because of issues beyond our control, right? We're not going to be able to affect the rainforest here in New York. We can affect New York in climate, but that's about it. The tariff situation is going to affect us. We do a lot of business with Canada, and Canada's not been visiting New York, so we've lost a lot of revenue from tourism, and people in Canada just visiting their relatives in the States. People aren't coming. And that's a big issue upstate, and it affects the more rural communities and the farmers, because there's a lot of products that we sell to Canada and vice versa. And that I don't really have a good handle on that current state of affairs, right? I think we'll be learning much more about that as we go forward. So
thanks, Joanne. Assemblymember Chang? We can't hear you yet. Yeah, we still can't hear you. We don't want to lose your comment, so if we can't figure out the sound, maybe you can put it in the chat. Technology.
Yeah. I just want to jump in because I have to go to another meeting.
Okay, great.
Until Lester can get it on and we can hear him. I just wanted to say, I know it may sound like we are just we can't give like a direct answer on a lot of things, and it's because we are in the unknown as well. So we're all dabbling in the unknown, and we don't know really until we know, because no one knows what's really coming next or how it's going to be affected. What is good though is that you guys did have this meeting for us so that we know what your needs are. So when we're up there and if something changes, we have it in real time. So I don't want it to sound like discouraged, because you guys are asking great questions, although we don't have the answer that can even lead to something that, could be promising. It's just really up in the air for all of us. And as we see how the funding goes, or just where we could, like you said, entities can partner up in different areas. We won't know any of that until after we get in and see what's happening. So right now, to say anything concrete is kind of hard for us as legislators, because we don't want to say anything that could give, like, okay, this is where we could possibly partner up to get funding from, or we'll be safe here or there. We can't really say that right now. The only thing we can say for everyone is give us what it is your needs are, your wish list and things like that, so that when we're in the middle of it and it's like, oh, okay, we do have more money in this area, we kind of know what to do already.
Understood. Thank you, Member Hooks. Also, we're going to be visiting you for our lobby days in February, so by then maybe we'll be able to have more of a conversation about it.
Yeah, like last year, I definitely said that, you definitely have a partner in me. As you know, my cousin Jade is a part of you guys' program. Jade Watts, my Aunt Yvette is down there. I can't see you, Aunt Yvette, but I know you're on here somewhere.
She's right here, yeah.
Trust me, she will never let me not think about this first. So just know, and yeah. Exactly. So just know you have a partner in me, and I'm sorry that I have to go, but happy holidays to everyone.
Thanks. Same to you.
All right. Bye-bye.
Assemblymember Chang, I think you figured it out. Oh no.
There's another box for him that's still muted. I don't know if it's on 2 devices or not.
Oh. That's right. So actually, if you also called in from your phone, then maybe we can hear you that way.
Can you unmute him, Winnie?
I can't, but Cheryl, maybe can you?
No, all it does is ask him to unmute himself, which he can't do.
All right.
Someone, if you click on the audio option, the caveat next to the audio unmute, and if you click to switch to phone audio on the pop-up, it'll give you a phone number to call in, and it should work from your phone. So the little up arrow next to audio, and then switch to phone audio.
This is a desktop computer.
Well, you could also, Assemblyman, go back to the invitation to join, and there should be a phone number there that you can actually call in from your cell phone.
Connecting here.
There you go.
There you
Excellent.
go. Start video.
Got it.
All right.
Here you go, Assemblyman.
All right. Now using
Now just
Gotcha.
log off the other one.
We have 3 of you.
No.
let me log this off. Okay.
Okay.
All right. Thank you very much. So, thank you very much for hosting this, and I appreciate this. I support most of the social type of community service, especially for our challenging, disabled, challenged people. But we have so much money that we allocated. There's no question about this. And I'm more concerned is what Minnesota have demonstrated tremendous amount of fraud out there. So I hope there's enough safeguard to prevent this kind of fraud, because it's robbing the money that we should allocate to people who deserve. And I don't know what safeguards we have done for truly people who deserve, because I'm sure there's some fraud and waste somewhere.
I hope we have that in place. And I don't mind, and I support all these supportive services, especially people who are disability. Even in my community, I can see this tremendous amount mentally challenged, but the parents, the families don't want to come out. Except when I see them in Chinese New Year, when we give out free giveaways, then I see them out there, these people. So that means we're not doing enough to outreach for them. But at the same time, how we can balance that for outreach and also safeguard the money that we pay for.
So it sounds like you have two questions there. And the first I'll just begin to comment on, but I'd like to hear from our audience here. And that is, we're highly regulated and monitored and by our state agency, OPWDD, and also by the Office of the Medicaid Inspector General. But I'd like to turn it over to our panelists to answer the regulation question first, the fraud and abuse question.
Hi, thanks for joining, Assembly Member. Chris Marchione. I operate a nonprofit organization and been doing this work for 36 years. And as Winnie said, yes, we are highly regulated. And New York State does a very good job. I believe since 2006, the Office of the Medicaid Inspector General was established to ensure that, to reduce, prevent fraud, waste, and abuse. And from what I understand from their last report, which is available on their website, they have recovered over $3 billion in waste, fraud, and abuse. And a lot of it is overpayments, and most of it is also agencies like mine. We self-report. When we find an error, we give the money back. There are some bad apples out there. Hopefully, less is better. And we try to, reduce that. But I also wanted to touch on what you said about people not coming out, that they're inhibited from coming out. They're afraid, probably. Most
Cultural, well.
Yeah.
Yes, and with people with intellectual disability, New York State OPWDD recognizes that they probably support a little over 130,000 people, but it's estimated there could be up to 500,000 people in New York State living with an intellectual developmental disability. So we also, while we're on this call and we're asking, for all of these things, we also want to change the way people see and value people with intellectual and developmental disability. A lot of studies show that they're lonely, hard to make friends, and it's very challenging to belong to a community. So I'm with you on and I'm sure all of my colleagues are too, on preventing fraud, waste, and abuse. But at the same time, we want to support, the people that we care about the most.
Yeah, so $3 billion, as you were mentioning about, that's quite a bit of money, $3 billion.
And like I said, most of it is either overpayments that are returned. It's hardly anything that is done intentionally. You could look at the report. It is available on the Office of the Medicaid Inspector General's website. A lot of it is self-reporting. We find our own errors. That's how much we care about the work that we do. We do it right, and we do it with integrity.
Yes. In fact, when the federal government started talking about eliminating fraud, waste, and abuse with the Medicaid cuts, we actually quantified that at New York State. And New York State is doing such a good job of preventing fraud, waste, and abuse that it's like a fraction of 1% of the Medicaid budget that goes that way. I mean, New York State is the best at making sure that doesn't happen. So in addition to the fact that, I don't know, 99% of providers, 99.9, are really in it for the right reasons and put all the money into exactly where it needs to go, services and salaries for our frontline staff who provide the services. We are right on top of any fraud, waste, and abuse. So there was no savings. That we were able to debunk that claim by the federal government, because there certainly wouldn't have been enough to find to fuel any cuts there. But thank you for those really good comments.
When you talked about outreach, I just want to say many of my agencies The multicultural agencies are in some of the very areas, underserved and underdeveloped areas. So families can really, and many of my colleagues here serve those areas as well. I've been in this industry, now my daughter's 40 years old. I can honestly say that from the beginning, when many of those areas were not necessarily a priority, it's really changed. Does it need more work? Of course it does. And that's why we need to continue to fund these agencies who know. I mean, even the Chinese Planning Council, which I'm sure you're familiar with. I remember when it was just so much of a undercover situation, and now you see many of the Chinese families, Asian families coming out to the DD councils meetings and really making sure they get the supports and services that they need for their families. So we want to continue the good work that we do with the help from our partners like yourself.
Okay, on to question number 3 with Evelyn. You're muted still.
And I'm talking up a storm here. So Medicaid is primarily our source of funding, and we're always very concerned that the rates are not keeping up with the actual cost of providing services. We're very thankful for the COLAs and the targeted increases, but they have not really made up for the ground that we lost during those 12 years that we didn't have anything. The legislature has always supported our asks, and we're very grateful. But at the final budgets, we don't see what we're asking for, right? So what can we do? What steps can we take together to support, to get this support and get it reflected in the final budgets?
That's a great question. It's one that I think most of my legislative colleagues would like to know the answer to. And that is that it's, the slicing and dicing, it's always a mystery to us as well. And it's something that, a lot of us are committed to and have talked about. What it is that will really change that picture going forward. Certainly the executive now is more responsive, but not as sufficiently responsive, right? All those years was through other administrations where there was, essentially flatlining, right? But also you're in a hole, right? So filling that hole is a very big deal. And so progress is great, but it's not enough. And so I understand that situation. And we were all very unhappy with what the increase was last year. People are going to be raising that issue again. And you're right, the impact of Medicaid funds and Medicaid reimbursement rates, all of that is it up in the air, because one of the challenges we face in Washington is not only do we not know what they're going to do next, is that we don't know what the president's going to do, and he changes his mind all the time. And he could be saying X one day and Y the next, and then change his mind back again, and so that's one of the challenges. It's very hard to even advocate with Congress because the majority is pretty much at his beck and call. And they too can't plan, right? I'm sure that they're very frustrated as well. When you're in office, you want to have a clue what's going on. And even if you're supportive of many of the same changes that they're talking about, it's nice to have a sense of stability and know what you're doing next. And that I think is something that is a challenge to members of Congress as well. And I can only surmise, right, because I'm not there. So I do think that it is going to be a challenge to read those tea leaves. And, as, Assembly Member Hooks mentioned, we don't really know any more information than you guys do, which is a frustrating thing. And I realize that you're looking for answers and guidance, and we don't have a lot to give at this juncture.
Thank you.
Evan, what's the cost of the TII state share?
So the total cost across OMH, OASIS, OPWDD, OTDA, OCFS is going to be about $280 million state share, which then is, matched federally, which is always a good thing to maximize federal reimbursement. So it has a pretty good kind of true up amount, which obviously puts in a good, amount of dollars into the systems to really keep, supporting programs and costs and things like that. So 280 million's our estimate at this point.
Across all those systems. So
Yep.
Thanks, Evan. Okay, any other thoughts on that question? Okay. All right, the fourth question with Marco.
Thanks, Winnie. We've heard and said a number of times now that the advocacy has paid off in recent years, and we're seeing Medicaid rate increases and the inflationary trends have an impact, and we're tracking this data. NYDA has done a great job with that, and we all track our data internally in our organizations. And we are seeing vacancy and turnover rates come down. We have a number of proposals that we are directing toward growing and supporting the frontline workforce. But we're curious what you think might have the greatest impact on supporting the workforce.
Well, that's one of the big challenges is if I knew what worked, I'd be a rich woman, and that is, it's really soothsaying at this point. It seemed to me that we've made the case numerous times. And what we get back is something that is, lacking. And what I don't know is what is the what's the word? The tipping point with the executive.
Thank you. I have a follow-up, more of a comment and a question at the same time. There's $1 billion went into mental health last year. Joe mentioned it earlier. Some of us have benefited from that because we were seeing a growing number of people with IDD, co-occurring behavioral.
Yes.
And thank you for supporting that. I'm sure you did. But I would speculate, just for my own role as a citizen, that the reason that happened was because the public was seeing that there was a need that needed to be fixed, a problem that needed to be fixed. And, we're a success story by and large. And, with all due respect, government doesn't often invest in success stories. They invest in problems so they don't reoccur. And with that mindset, which I know you don't believe in, I can tell, because I know you reasonably well and your commitment to the field. But is there something we could be doing differently in our advocacy efforts, telling our stories? Is there something that grabs the public's attention in some way that does draw more resources into the system?
One of the things I think that people are responsive to is where you're saving money for others, right? And so, the reason to invest in success is that it pays dividends.
Great example.
Right?
Yeah.
And where is that dividend? Well, a lot of times people don't see the dividend, right? They don't see that proper, care and programming and housing for people with disabilities. It's not a revenue center; it's a cost center, right? And they don't see it as an investment that pays dividends to us as a society, right? You hear a lot of the conversations around homelessness and public safety. And part of it is the ick factor, right? With people who are homeless and people not understanding that. But if they're gone and they don't see them, right? That was a lot of what I think was about the business community supporting changing the standard by which you could involuntarily commit somebody. The challenge was in New York City, which was sort of the ground zero for this, they were already using that standard. And it didn't actually change things because that's not the problem. The problem isn't admission. The problem is, what do you do after admission, right? And now the business community has come to me wanting to talk about how they can help with that. And I'm like, this is the conversation I wanted to have last year, because the number of people that actually meet that standard is very small. But in the public's mind, it's everybody who's hanging out in Penn Station, which is not the population that actually would meet that standard, right? So part of it is we were arguing over a standard that actually would affect a very small number of people. But in the minds of the public and in the minds of the business community who were really leading this, it was many, many more people. And what they have come to realize is that it's the what's next that is what we need to address. And there are complicating factors with regard to supported housing. Not all supported housing is right for every population, right? Some are needed for people with developmental disabilities, IDD population, who may also have mental health. But then there's people with substance abuse. And of course, those people may also have mental health issues, and they may, in fact, have IDD diagnoses as well. And so not every placement is going to be the right place for somebody. There's an issue with housing and repairs. And in the city of New York, we have had an increase of available beds without getting people into those beds. It's been a real challenge that's increased. And that is a combination of things, a combination of the city not spending the money that they have in their budget from before to actually do repairs. It's a lack of, I think, a lack of vision. And I think part of that is, the mayor's focus on public safety in a particular frame, when public safety can be viewed in a different frame as well, and it needs that frame expanded, so that the public is safer when people have housing, right? And that has nothing to do with criminality. There's, if the Catholics refer to the near occasion of sin, right? So if you're not doing, I'm revealing my past. If you're not taking care of things, you're basically giving people, too many opportunities, right? So if people can't get food, they're going to steal it. It's like, Les Miserables, right? When you have deep poverty, when you have people who don't have a place to go, you can imagine that things will happen. And if they don't happen, then people are worried about it happening. And so a lot of the concern, the public concern, is about people being fearful. And people are fearful of people with disabilities, right? We have way too much history of that. And so I think one of the things that I'm becoming somewhat more hopeful about is the fact that folks who really have been focused on this standard issue are becoming more aware of the fact that people need a place to go after hospitalization. That hospitalization doesn't cure them, doesn't give them life skills. It stabilizes them. And then they need to be somewhere else. And the city has come up with a bridge to home thing where H&H is monitoring that and staffing that, and it's a good idea, right? But then there's also the need for supported housing. There's also transitional housing, right? And so you have people who need to be out of that housing in 30 days. Well, in fact, a lot of those transitional locations, people stay there longer. Right.
Of course.
Because they can't find that, right? I was at one place where they said, people we find homes for people mostly after 30 days. They're supposed to be here for 30 days. And I know somebody who's lived there for easily 15 years that I've known the person there, right? Because that person does need supported housing on an ongoing basis. And they said, well, yes, there are some people like that.
These are such great points. And back to your original comments.
Sorry.
Part.
I got carried away.
No, believe me, Joe and I are engaged, our agency is engaged in some of this work to try to get people out of hospitals and put them into more suitable places and saving a lot of money. And we need to publicize that a little more. But I'm thinking about the workforce, and we know that the jobs that we give people keep them out of poverty. They're barely on the fringe of it, but we do keep them out of poverty because of those jobs. But also, we know more or less the cost of turnover. And I
Yeah.
don't think we've recently done a benefit analysis on what the turnover rate was and what that
Hmm.
cost the provider community on average. Now, what it is now, we probably saved, the state has probably helped us save tens of millions of dollars in reducing turnover. And that's something we could probably calculate or at least get into a range. I see Joe's hand is up, but these are great ideas. Thank you.
Thank you. Can I just mention that, again, one of the other services that we have currently been engaged in is operating all those housing options you just mentioned. We have affordable housing, we have temporary housing to permanent housing. We also operating shelters. In the last few weeks, we opened up a new shelter. In a matter of 2 weeks, it was filled with 200 men. We have well over 400 folks in our shelters living in families and men, but half of the population are working. Those are
Hmm.
folks, they're here in the city, they're working hard. They're not folks with mental health issues. These are people who are working in jobs and just cannot afford housing. And unfortunately, some of those folks in shelters are our employees who are working in the IDD world. They just
Yes.
cannot, make ends meet because of the housing, crisis that we're having here in the city. And if we were to help our employees, not just our employees, but all New
Yeah.
Yorkers, but focus on our employees, that is a less costly service to the city because we're spending millions on shelters right now.
You raise a good point, and I'm remembering Governor Cuomo when we were able to show that we people in McDonald's were making such little money that they were getting public benefits. Right now, we know Walmart does that too. A lot of the Walmart workforce are people who are getting public benefits because they're underpaid, right? And that made him nuts. And so he then did the deal with the McDonald's workers, right? And it may be that pointing out that, the workforce earns so little that they are reliant on shelter because they cannot afford housing. And that's why we need to pay more, because the dividend there is fewer people in shelter who are working in jobs and just can't pay rent.
Thank
That
you.
may be a way to demonstrate that, because that made, Cuomo nuts.
And if it worked with him?
Let's
Yeah.
go.
And it started that battle for, a more living minimum wage in New York. Doing the McDonald's workers, right? The fast food workers wasn't all just McDonald's, right?
Right.
But the fast food workers made a big difference and started that ball rolling.
Well, I think we all appreciate that, but my colleague can certainly jump in. But I think that hurt our field because as
Yeah, we did. But
yeah,
I'm just saying,
sorry.
you got to find a way to pitch
Sure.
it so that it doesn't hurt you anymore.
That's right.
But you're right.
Yeah, because
You're absolutely right.
I think again, our employees are saying, well, hey, we could be working at McDonald's and not have the Justice Center and all these other issues. And,
Yep.
Obviously our workers are making a good impact in people's lives. And no disrespect to people working in the food industry, but we have people who
The
are
chicken McNuggets are not improving people's lives.
correct.
DSP is a profession. It's not a minimum wage job.
Yes,
right?
exactly.
And we've been working very hard to professionalize the workforce because the work that they do, at my agency, we have individuals who aged out of ACS. So the staff becomes family. They're their everything. And, the Christmas cards that they make at the program is to the DSPs because they're their everything. So, this is not a minimum wage job. It is a profession. It is done with care and support.
And so one of the challenges we have, not to belabor the point, but we have a federal administration that has decided that nurses and nurse practitioners and audiologists and speech therapists are not professions, so that they're not going to support student loans.
Wow.
Right? So federal student loans are not going to be available to people studying in those fields because they're not professional. This is by executive fiat. And so what will happen is fewer people will get degrees. And the big, beautiful bill also made very onerous student loan requirements for repayment that do not match anything in reality. And so because people cannot take on in advance, knowing that they're going to have to pay back a certain amount according to a certain schedule, and they may never make enough money to do that, certainly not as new workers, they're just not going to go to college, which is part of what I believe the administration would like is fewer people going to college because they're kind of denigrating, degrees. But I got my first degree in speech pathology and then in teaching the deaf, and I took student loans out. That's the only way I was able to go to college. Right. But now apparently that wasn't a profession.
We could talk about that for a long time, and it would only make us all miserable. That's
But I think that, the issue raised is the fact you do have a professional workforce who aren't being perceived as being professionals.
Exactly.
And that is a big issue.
There is something
right?
here. I know we're trying to probably stick on time. There is something
Yeah, and
here
I do
that,
have to
that
get
wasn't
going.
intended. And we are living within a larger context. We are supporting people with IDD in a larger context. And that exists both within the silos of the New York State government, where terrific people are doing their very best to do good things. And you heard about health, you heard about behavioral health, you heard about children, you heard about ACS, you heard about education. So our narrative sometimes needs to be broader in terms of where this fits into a person with IDD's life, number one. And number two, you can only control what you can control. So I think that we're going to continue, and you've been fantastic at driving this conversation, because even we can get too siloed in our conversations. It's not just transactional. The money matters 100%. But if we're going to get people and legislators to think along with us and give us the ideas as you have, and to tell the story about the value of the human lives of people with disabilities in this state, we have to talk more like we're talking tonight. And I really appreciate your comments. They're very, very valuable.
Winnie, I just want to add one quick thing about the professions that are not professions anymore. I mean, in some cases, these are like mandated by law that certain levels of certification is required in both school settings and OPW settings and mental health. So, I mean, it could create a whole system collapse, and that we already are in that situation where we don't have enough professionals to serve the number of people that need it. So, I just want to emphasize that piece.
Thank you, Lisa. Okay, we have two more questions left, and then
okay, and I have to hop because I have another event to get to.
Okay, I know you do. Yvette has got our next question.
All right. So advocacy is something that we're known for. This profession started from advocacy. And we know as legislator, you see hundreds of thousands of people when legislator is in session. And, we're always in Albany. As Winnie said, we'll be there soon in February. And we continue to come up and advocate for our profession. What strategy do you believe that are more effective for ensuring that the needs of the IDD community remain visible and it is a priority? What can we do better?
I think one thing is to differentiate yourself from some of the other populations that are sort of inadvertently competing with you, right? People talk about people with mental illness. They talk about recovering, folks getting out of jail, out of prison, who need housing, for example, often need supported housing, need some transitional housing, and may have lots of similar issues, trauma, cultural competence issues, et cetera, et cetera. So one thing is, you're competing with people that people think they understand better, right? I used to, I did disability services in higher ed for years, and people would argue about learning disabilities like they're not real, right? Because they didn't really understand them, but they thought they understood blindness. They didn't understand anything more about blindness. They had no idea, right? But they thought they did. And so some of it is um, uh, uh, the lack of experience people have with the population. I'm not sure that dragging people into Albany is the best way for people to develop experience with that. Um, uh, uh, because there's so much, hubbub. Um, and the other thing I would suggest is maybe doing a Monday instead of a Tuesday. Because the legislators don't really arrive until later in the day, some of them on Mondays. But just the elevators on Tuesdays is impossible. And so one challenge for legislators is being in different places at the same time. And I know sometimes when there's something out in the civic center there, the convention center, hard to get out there. Right? And so sometimes people, that you've got a big rally, got a lot of people, and people are frustrated by that, but it's also very difficult to get out there when you're supposed to be someplace else at the same time. So one of the things is the sort of logistics of what you're doing and where you are. And having a rally on a different staircase than the $1 million stairs is sometimes helpful because there's such competition for that.
About the war room.
Yeah, well, the war room is increasingly being used, as you know. And it is at least in the same building once people are in session. They can get there without going back over across the street.
That's right.
Um, and so they're just some of the, physical logistics like that might make a difference in terms of not spinning your wheels.
Thank you.
Kind of thing,
Thank you.
right?
Those are great suggestions. I have one more follow-up to your question. How can families and self-advocate and providers collaborate more effective with your office during the legislative sessions?
My problem is that I'm sort of on board anyway. And
Not a problem to us, by the way.
yeah, no, but I'm just saying that's I'm not the one you need to get to. So I can't say that there's anything in particular that I would say is something you could do better in terms of me. Now, last year, for example, taking over the mental health committee, and no longer having ethics, I had like something of a learning curve on some things. There's still some things that is really the mental health infrastructure throughout the state, which I wasn't working in, right? I know something about mental health, but I don't know every county and every group in every county, et cetera, right? And so, there's still some elements of learning curve for me. And that is true as well of, the OPWDD, right? And they've certainly been more engaged with legislators in recent years in my sense of things. I could be wrong, but that's my sense. And that's a good thing. I think some of the things that is challenging for legislators is who's doing what with what, right? Now, supported housing. We have supported housing and supportive housing. What is the difference? Somebody spelled it differently in a budget, and now you've got, right? It makes no sense.
It does.
I've been talking about this for 10 years. And nobody has a good answer except, well, we've got this funding stream and that funding stream, and this one goes to, whatever. OTDA versus the OPWDD and the, whatever, and OMH housing versus somebody, right? So this is confusing to people. And so people get things muddied.
And that is why NYDA is so good, and we have Evan to pull us together, because we really have joined to have joint asks that, make good sense. It looks like we lost Etofia, and she had her hand up. I'm sorry.
Oh, okay, sorry.
But we'll follow up with her later, because she did ask for the slides, by the way, Evan.
Okay.
So thank you so much for all that.
Thank you.
And the last question with Chris.
Yes, hi. So this is for any of the legislative staff, as well as you, Assembly Member, regarding how intricate and complex this service system is, and to be reminded, it is not designed by people who have intellectual disability. What information or what type of engagement would best help for legislators to really understand the challenges that people with intellectual disability face, so that you can, advocate better at the government level?
I don't know. It's hard to know who's listening at in the executive, right? Because the people who are, the chief lawyer it's not going to be talking to everybody, right? So I think that one of the challenges is, how do you organize yourselves so that people are having higher impact conversations, for lack of a better term. I just made it up. And maybe the NYDA approach may make a big difference there. I can't speak for staff members, and I know that they often are the people that are the front line. And so I certainly defer to the staff members that are on this call.
Yeah, Steph, Usman, Michi, Galan, if you had, what is the best approach? Is listening to people with intellectual disability, hearing their life stories, their experiences, meeting you in your office, a phone call, a Zoom, like which approach do you think is most effective so that you can understand the challenges?
Yeah, this is Steph from Assemblymember Valdez's office. I was just going to say, I think oftentimes, kind of getting to Assemblymember Simon's point about kind of how hectic it can be during session in Albany, especially on Tuesdays. I think just doing maybe more in-district office visits, if that is possible, and so that legislators and staff can really develop relationships with people in their districts, and that can be an ongoing thing. And I know a lot of folks do this work year round, but it does often feel like it's like, okay, come January, February, we just get bombarded with groups and we're happy to meet with everyone, but it can kind of get, just lost in the shuffle of everything we're doing. And if we can maintain a relationship with some of the agencies and the individuals who are doing this work in their own communities, I really think that can make a difference.
No, that's a great point. And it's one of the things that we actually try to do in the off session through NYDA. Is we did an in-district legislative challenge where we had agencies doing meetings and kind of competing, getting points to kind of actually do that in that off session time of like getting out, doing tours, seeing folks. One of the great things that happened was over 60 legislators got hit in that process. So that was definitely a benefit. And I think, something we're going to continue to do going forward.
Yeah, I will say for myself sometimes, like I don't want to see people in the summer. We just got out of session. We have all this stuff that we have to do to sort of catch up with things in the district. And so I think for a lot of legislators, the fall is a time where they're starting to think differently about what they're doing next year, what their priorities are, what they might anticipate the issues are going forward. I think this year has just been a confusing year, generally, because there's so much that is related to what's happening in DC. And just a lack of stability in terms of, the financial situation. But I know, deep in the summer, a lot of folks would rather not have at those meetings, and certainly as staff may be fine, but it's much harder to get legislators, I think.
Thank you.
Okay, any other comments or questions or thoughts that anybody would like to share or ask? All right. Evan?
Nope, just I want to say thank you for everybody for taking the time. We greatly appreciate it. Your insights are incredibly valuable and helps us, inform how we advocate for our priorities and for the field. So thank you.
And we look forward to seeing you in Albany and in the district office, but not in the summer.
Thank you.
Thank you very much.
Thank you all.
Thanks.
Thank you,
All righty,
everybody.
thanks.
Thank you. Bye-bye.
Everybody,
Good night.
thanks so much.
Thank you.
Happy
Good night.
holidays.
Thank
Happy
you, you
holidays.
too.